So imagine you're a physician working in an ER in a big city hospital in the middle of flu season. You're seeing a lot more cases of people coming in with flu-like illness. You know from year to year, some flu seasons are worse than others, but something about this year seems different. A lot of them are testing negative for the influenza virus. Maybe it's the number of people, maybe it's how much more sick they seem, maybe it's how many are dying. What do you do? You probably start off by talking with other doctors in your hospital and doctors at other hospitals in your city. Are they seeing the same thing? What could this be? Is this just your imagination? Is this just a bad flu season? Or is this the start of something new? You know that's happened before. If it is something new, what is it? Is it a virus? Is it a bacteria? How does it spread? Who's at risk? Who do you tell? What's the risk of speaking up if you're wrong? What's the risk if you're right and you don't speak up? And most importantly, how do you treat your patients? This is exactly what happened in Wuhan, China in December 2019. Dr. Li Wenliang at the Wuhan Central Hospital and a handful of other doctors were seeing a lot of patients that didn't look like the flu. It looked more like a disease that emerged in China in 2003, but we haven't seen it since. While other doctors were seeing the same troubling signs, health officials and authorities thought they were overreacting. It wasn't until Dr. Li got sick and eventually died that Chinese authorities realized he was right and began to take the problem seriously. They built 2 1,000-bed hospitals in about 10 days. They imposed the largest quarantine in human history. The lockdown started in Wuhan, a city of 11 million people, but eventually spread to over half the country, with some 760 million people confined to their homes for as long as 76 days. That's roughly 2.5 months. While these measures seem to have dramatically slowed the spread of the virus, both in China and outside, they still weren't enough. By the end of January, it had already spread to at least 20 countries, including the United States, and was well on its way to infecting every country on Earth. So what is it? How did all this start? The what is it part we can answer. How did it start? We're still working on. So what do we know first? The disease that kept you from attending prom or graduation is called COVID-19, not to be confused with the virus that causes the disease, which is called SARS-CoV-2. So why 2 names? In the early days of the disease, we were pretty sure this was caused by coronavirus, but we weren't sure if it was a new one or one we'd seen before. And we still weren't really sure what the disease was. But we needed something to call it. So COVID-19 was proposed as a placeholder name. It's an abbreviation of Coronavirus Disease 2019. As we learn more about the specific coronavirus that causes COVID-19, we learned it's a close cousin to a coronavirus that emerged in China in 2003. That one was known as SARS, which stands for Severe Acute Respiratory Syndrome. Since these viruses are related, the virus that causes COVID-19 is called Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. I know virus names aren't very sexy. Historically, diseases were named after the person who discovered them, like Crohn's disease. But being a kid in school is hard enough without having a last name of a disease no one wants. So we started naming diseases after the place they were first found, like Norwalk virus. But that's not great for tourism if every time someone gets food poisoning, they think of your town. Which is why norovirus is no longer called Norwalk virus when the people of Norwalk, Connecticut didn't want to get blamed every time someone got diarrhea. Especially since it wasn't even them to start with, the virus was originally named after Norwalk, Ohio. So where did SARS-CoV-2 come from? The short and honest answer is we still don't entirely know, but it most likely originated in bats in China. But it's not clear if it jumped straight from bats to people or if the bat virus first moved into another animal before it jumped to humans. How do we know this? So coronaviruses are a large family of viruses that we've known about for over 60 years. There are different types that we know can infect different animals, even humans. Since all this started, you probably heard that we already know about a few coronaviruses that can cause the common cold, but there are a lot more coronaviruses in bats. The first SARS virus from 2003 started off in bats. Another deadly coronavirus called MERS started in bats as well. In both of those cases, we could look at the genes of the viruses in sick people and the genes of similar viruses in bats and other animals and retrace the steps of how it jumped from bats to other animals and then to people. In the case of SARS-CoV-2, it's 96% similar to a known bat virus. But that last 4% difference is different enough that it looks like it may have infected another animal first, where it evolved to better infect humans. But we're still learning about this virus, and people are actively looking for coronaviruses in animals, trying to piece together this virus's family tree. The fact that we haven't completely answered this question yet has led some to speculate that this means China engineered this virus as a bioweapon, or it somehow is an unnatural virus that escaped from a lab. While there's no way to completely disprove that, there's no evidence to support that idea. The good news is humans will never be as good at making bioweapons as Mother Nature. The bad news is Mother Nature is pretty darn good at it. While we have the technology to do something like this in theory, if it was made in a lab, the virus would look like a Frankenstein cut and paste job. The genetic equivalent of a duck's head glued to a squirrel's body, or something like that. One would see both the unusualness of the parts and the traces of the glue. And no virologist I know thinks this is anything but a case of an animal virus spilling over into humans. It happens more than most people realize, and in fact, most infectious diseases of humans have an animal origin. But if the SARS in 2003 and the MERS in 2012 were coronaviruses that jumped from bats to people, why haven't you heard of them? Why did the SARS-CoV-2 bat coronavirus spread so quickly around the world, but these others didn't? Again, the honest answer is we're still learning, but it looks like there's a few key factors at play. This virus seems to be a lot better at spreading from person to person than these other bat coronaviruses. All three can spread from person to person, but for the 2003 SARS and the 2012 MERS, you needed to be in really close contact with an infected person for a longer period of time. That meant healthcare workers and people living in the same home were at the greatest risk, but there wasn't as much spread in the community. Also, with these earlier viruses, people were the most infectious when they already felt pretty horrible. They had already gone to the hospital or they were staying home from work, so they weren't around as many people to spread it to. With SARS-CoV-2, it appears like a lot of people are infectious and spreading the virus before they realize they're sick. This means they're going out to restaurants, bars, parties, and spreading the virus, and only a few days later do they develop symptoms. That's why health officials have been stressing wearing masks and social distancing. This isn't perfect, but it helps limit how much you might spread the virus if you're infected but you don't know it yet. You're wearing the mask to try and keep from infecting anyone around you, and they're doing the same for you. I know masks, social distancing, online classes, no Packapalooza, maybe no college football, maybe no college basketball. All that has taken a toll on what should be one of the best times in your life. I know you've been asked to give up a lot, and it seems like this is going on forever, but this will end. We will get through this, but it's going to take all of us sacrificing a little longer so we can protect those who are at the greatest risk of dying from this virus. At least until there's a vaccine. But until then, as new members of the pack, we, the entire Wolfpack, the entire state of North Carolina, your friends and family, need you to be part of the fight against COVID-19 and future pandemics. The one thing I hope you learn from this course, no matter what major you end up in, with wicked problems like this, no one discipline can solve it alone. And every major, every department has something to provide to the solution. It takes talented, passionate people from all different cultures, races, genders, orientations, and perspectives coming together to truly solve the world's toughest, wicked problems. We're all counting on you, and I'm looking forward to seeing how you work together to make the world better. Good luck with your first year at NC State. I look forward to meeting you in person while you're here, but until then, stay safe, wear a mask, wait at least 6 feet apart, wash your hands, and go Pack.